The next topic is peptic ulcers. Okay, we all know that peptic ulcer is associated with H. pylori, and peptic ulcer is divided into two main types: duodenal ulcer and gastric ulcer. Okay, now some important points regarding the peptic ulcer. What is the most common type of peptic ulcer? So the most common type is duodenal. Okay, what is the most common site of peptic ulcer? Most common site is B1. Okay, another question. Most common site of gastric ulcer is, I have already told you, at level of incisura angularis. Okay, overall if we are seeing, the most common site of peptic ulcer is D1, but the most common site of gastric ulcer is at the level of incisura angularis. Okay, now they both are associated with H. pylori. Okay, but duodenal ulcers are associated with H. pylori in 90% cases. Okay, whereas gastric ulcers, they are associated with H. pylori in 75% cases. Okay, now in duodenal ulcers and gastric ulcers, there is difference in how they are being treated. Okay, so for duodenal ulcers, treatment depends on the complications. Generally, what we are going to do, we are going to give them PPIs and other medications. But in case if there is complication, then we'll have to deal with the complication. What is the most common complication? If the duodenum is if the ulcer is on the anterior wall, then the most common complication is perforation. Treatment for that is Graham's patch repair. If the ulcer is on the posterior wall, what is the most common complication? Bleeding. Bleeding is from the gastroduodenal artery, and the treatment is duodenotomy and then ligation of the bleeding gastroduodenal artery. This is regarding the duodenal ulcer. Whereas in gastric ulcer, the treatment depends on the location of the gastric ulcer. Okay. Treatment depends on the location of gastric ulcer. On the basis of location, there is a classification, that is modified Johnson's classification of gastric ulcer. Okay, this classification is very important for gastric ulcer. It is for gastric ulcer. Okay, so on the basis of this modified Johnson classification, it is divided into 5 types. The type 1 is gastric ulcer at incisura angularis. Okay, type 2. In type 2, there are 2 ulcers. One ulcer is at gastric body and second ulcer is at level of duodenum, at the level of D1. Okay. Then comes type 3, which is a pre-pyloric ulcer. Okay, type 3 is a pre-pyloric ulcer. Type 4 ulcer is higher on the lesser curvature, high on lesser curvature, and type 5 is NSAID induced, and it can occur anywhere on the stomach. It is NSAID induced, can occur anywhere. In stomach. Okay, now comes the next point. What is the most common type of gastric ulcer? Among all these, type 1 is the most common. Okay, I already told you that incisura angularis, the ulcer at the level of incisura angularis is the most common type of gastric ulcer, which is type 1. Okay. What is the treatment for type 1 gastric ulcer? It is distal gastrectomy. Okay. Now, out of these all ulcers, it is the type 2 and type 3 ulcers who are producing more acid. So, there is more acid production in type 2 and type 3. More acid production. So, what is the treatment for them? The treatment is truncal vagotomy and entrectomy. Truncal vagotomy. Treatment is truncal vagotomy and entrectomy for both type 2 as well as type 3. Okay, what is type 3? It is pre-pyloric ulcer. Okay, and the treatment is truncal vagotomy and entrectomy, and there is more acid production in type 3. Now comes the type 4. As you can see here, this type 4 is very high on the lesser curvature. For this, we have to do a named procedure. Okay, so there are many types of named procedures. I'll enumerate them for you, and some are based on only entrectomy, some are based on excision of only ulcer, and some are based on excision of antrum as well as the lesser curvature, whole of the lesser curvature of the stomach. Okay, and the names are Sandys, Pochet's, Shoemaker, and Kelling-Madlener procedure. Okay, so what they generally ask is Shoemaker procedure is performed in which type of gastric ulcer? So it is for type 4. Okay, so these names are important: Sandys, Pochet, Shoemaker, and Kelling-Madlener. Then type 5 is NSAID induced, can occur anywhere in the stomach. And what is the treatment? We have to stop NSAIDs. Okay, so the treatment is stop NSAIDs. So this is regarding the modified Johnson classification of gastric ulcer. Now some more points regarding the gastric ulcer. Now I have already told you this point that type 2 and type 3 is associated with increased acid production. That is why vagotomy is indicated in type 2 and type 3 only, and the treatment of choice is truncal vagotomy and entrectomy. This is the treatment of choice. Okay, for both type 2 and type 3. Now in type 1, 4 and 5, they are not associated with more acid production. There is either normal or low acid production. That is the reason why vagotomy is not indicated. Okay, so vagotomy is not indicated in type 1, type 4 and type 5 of gastric ulcers. Okay, now sometimes they are asking questions regarding the association with the blood group. Okay, so the type 1 gastric ulcer is different from the other types of gastric ulcers. Okay, this is first point. Now the type 1 gastric ulcer is associated with blood group A. So it is associated with blood group A, and the other 4 types are associated with blood group O. Okay, so this is regarding peptic ulcer. Now